This is the simple dressing change and sterile gloving video. I'm going to raise the bed, which I've already done. I'm going to enter the patient's room, wash my hands, describe the procedure to the patient. I would make sure I keep the patient covered as much as possible and provide privacy. I do need to expose the mannequin so that you can see in the video, but I would pull the curtain, close the door, and keep the patient covered. I'm going to go ahead and expose the area. I need to get my clean gloves on to take off the old dressing. And then I'm going to remove the old dressing. I'm going to be talking to you throughout the video, but normally I would be talking to the patient, explaining what I'm doing and what they should expect. I'm going to take off the old dressing. I need to take note to the drainage, the amount, the color, if there's any odor, because I need to make sure I document that when I'm finished the procedure. Dispose of the old dressing and dispose of my clean gloves. If I need to, I could rewash my hands at this point. So now I'm ready to set up my sterile field. I have my supplies here. I have a sterile waterproof drape. I have 5 2x2s. If you don't have that many, you can always, they're doubled, you can always separate them if you need to, but I'll need approximately 5. I'm going to clean around the incision site 3 times and then go twice around the drain. So I have 5. I have a sponge drain, which is just a slit 4x4, which works nicely around the drain, which you'll see when I dress the wound. 2 gauze sponges for the top, for over top of the wound in the drain. An ABD pad or abdominal pad, which is just a big bulky dressing. I have my sterile saline, and I have tape. And I believe I have a pen in my pocket. Yes. So I'm going to go ahead and get started. Drape. Because of the way this drape is folded, you need to make sure that you leave it in the package. If you dump it out on the table, the white part that is typically the side that you're using for your sterile dressings will touch the table and be contaminated. So I'm going to go ahead and also be careful when I lift up the drape to pick it up so it does not touch the table. Remember, when you open the drape, you have 1 inch around the drape that is not considered sterile, so it's okay to touch those areas on both sides. Either side of the drape is sterile, so it really doesn't matter how you lay it down or which side you use up, but either way, make sure that you do not reach over top of it. So I'm going to lay it down this way so that I'm not reaching and laying it this way. Now for this particular dressing change, since I have wet dressings and dry dressings, I need to make 2 piles. So I'm going to keep my wet on one side and my dry on the other side. And it doesn't matter which you add first. It doesn't matter where your wet or dry pile is. That is up to you. I'm going to go ahead and add my 2x2s for my wet pile. Being careful not to reach over the field, adding the dressings from the side. Sometimes these dressings have a tendency to stick to the wrapper, so if you give them a little ruffle in the package, it helps them not to stick. If they stick, make sure you don't shake over top of your sterile field. You'll also notice that my sterile field is at least waist high. You don't want to turn your back on your field, so I have my trash can and everything I need in front of me, and also have the table in a way that I don't have to be turning my back to be able to do the dressing change. You can always use 2 tables for this procedure, which might be better for your gloving when you're just getting started. So that's my wet pile. I'm going to make another pile which is going to stay dry. So I'm going to come around to the other side. Again, not reaching over the center of the field, but coming in from the other side. You don't want to get down too close to your field and risk touching the package to the field, but you also can't be adding dressings way up high because it's not very accurate as to where they fall in that situation. So I have my two 4x4s. This is my drain sponge. Again, it doesn't matter which order you add these in. Once your gloves are on, you can rearrange them however you would like. This is my ABD pad. If there's ever a question if the gauze was contaminated by touching you, then don't use it. Ask for a new one. If it falls within that 1-inch border, the same kind of thing, you can leave it lay. Just ask for a new one. It's perfectly fine, and that's what you would do in a real situation. So the next thing that I need to do is pour my saline. I need to make sure that I have the appropriate solution. This is sodium chloride, which is typically what you're using for a dressing change. I need to check the expiration date. Once I open the bottle, I need to put, write with a pen, put a label on it, the time, date, and my initials, because this is only good for 24 hours. When I pour my saline, I need to be careful not to reach across the field. So even though I'm right-handed and my wet dressings are on the right side, it enables me to pour it in a way that I'm not reaching across the field. But if I would have set my 2x2s on the other side, or put my 2x2s on the other side of the field, I would just switch hands or come across this way. I would not reach the whole way across the field. Be careful not to contaminate your lid. I usually just keep it in my hand. You don't want to get your fingers up on the rim of it. And I try to avoid even sitting it down, because then it's another pickup that you need to do. And I'm just going to sit this off to the side. So after I've poured my saline, I'm ready to don my sterile gloves. And like I said, this may be a time where a second table comes in handy for you, and it's perfectly fine to have another table. You could have it kind of butted up this way so you kind of have an L. Gives you a little bit more room. If you're using just one table, make sure that you're careful that the outside of your glove paper doesn't ride up over your sterile field. You know, a little bit would be okay, but you want to stay an inch away from your dressings. The other thing that I forgot to mention as I'm looking at my wet pile, when you're pouring your saline on the field, be careful not to get too much. You need to remember, if that saline would bleed, as it will naturally do, over the 1-inch border, then the entire wet pile is contaminated. So if you feel like you haven't put enough saline on there, you can always, once your gloves are on, pick it up and squeeze a real saturated dressing over top of one that's not real wet, but just be a little cautious with that. I'm going to open my gloves, and you'll see when you open the package, there's a picture on the front that tells you which glove is for your right hand and which glove is for your left hand. They're packaged with thumbs up. I'm going to pick up my first glove to don my dominant hand, so I'm going to pick it up with my left hand, back by the opening of the glove. You need to don your glove with your fingers pointed down. If you try to don your glove with your fingers up like this, these fingers are going to flat back and touch your bare skin. So lift your arms up away from the paper so you're not down here close and potentially contaminating, but have your fingers pointed down. Pull your glove on. Then the second glove, you're going to actually put all of your fingers under the folded cuff. And it takes a little maneuvering sometimes. The paper wants to go like this, so reach down here with your bare hand and hold the paper, because you don't want this to ride over top of your field. Pick up your glove, arms up away from the table and the paper, and pull your second glove on. Okay, a really important thing to remember when you're donning your second glove, you saw my fingers under the cuff. Keep your thumb out. You can use your thumb as much as you want to handle the glove, but once you pull it on, keep your thumb extended, because what you naturally want to do is use your thumb to pull the glove on, and then your thumb is contaminated on your arm. Once your gloves are on, make sure you know where your hands are at all times. If they drop below your waist, they're contaminated. If they're out here and you're turning around, you're touching curtains and things, so I usually just fold them and keep them in front of me until I get where I need to go. All right, so now we're ready to actually clean the incision site and around the penrose drain. You want to go ahead and squeeze out your 2x2s. You don't want dripping wet dressings or even dripping wet 2x2s to clean with. You don't want the saline sitting on the patient's skin. So the first area that I'm going to clean is over the suture line. I'm going to start at the suture line itself and start from the top to the bottom. It's important to remember when you're cleaning, you take one swipe with the gauze. You don't ever backtrack over an area that you've cleaned. So I'm taking one swipe from the top of the incision to the bottom, and I'm going to toss. I'm just going to use my glove paper for my trash. I've cleaned once over the incision. I'm going to use the next two gauze to clean out from the incision. So my next swipe will be to the outer part, and it doesn't matter if you clean the outer or the inner next. And I very well may need to have more gauze if this had a lot of drainage on it. Next swipe from top to bottom on the other side of the incision. Now cleaning around the drain, the penrose drain. Remember that the penrose drain obviously doesn't have a reservoir to drain into, so the drainage is just going right into the dressing. So there could potentially be a lot of drainage on the skin around the penrose drain and around the incision. When you clean around a drain or an incision, or rather a stab wound where the drain exits, you want to use a bullseye method. The one thing that's a little bit different to me about this is because of the very close proximity to the incision line, I usually tell students to go around it once and then kind of do a half moon so that you're not backtracking over the suture line that you've already cleaned. And this is what that would look like. So I'm going to go around the penrose drain once, and then I'm just going to kind of make a moon stopping at the incision so that I'm not backtracking over an area I've already cleaned. And I'll do that twice. And again, I may need to do it more. If there's a lot of drainage on the skin, I would continue to clean. So I'm just going to come around and then kind of do like a half moon around that. I would let the skin dry. The mannequin will take a while, so as long as you pause and even say when you're checking off or videotaping you would let the skin dry, that's fine. And then I'm ready to go ahead and get my split gauze. I'm going to separate. There's two layers. This works nice to go one way around the penrose with half of the gauze, and then the other half to come around the other direction. The nice thing about this particular abdomen is that the suture line and the penrose drain are so close that when I use the gauze and the 4x4s to go over the penrose drain, it actually covers the suture line as well. That may not be the case. You want everything covered though. And in all reality, I certainly may need more 4x4s than just two, especially if this was just a fresh wound in the last 24 hours. That penrose drain may be draining a lot, and I might need a really big bulky dressing to be able to collect all the drainage. My ABD pad is the topper dressing. It's folded. This particular one is folded, so I want to unfold it. The blue stripe goes on the outside, and I'm going to cover the wound. You do want to make sure that all the dressings underneath are covered by the ABD pad. If you had to use 2 or 3 or 4 or 5 4x4s, then you may need 2 ABD pads on the outside to make sure they're all covered. You would not want anything hanging out from underneath because that's going to wick up things from the skin and pull them into the wound. At that point, the sterile part of the procedure is over. Take off my sterile gloves. So I've taken my sterile gloves off at this point because the sterile part of the procedure is over. Probably a good idea at this point for the taping to go ahead and put clean gloves on just to protect myself. That's kind of your call. If this was a really clean wound and everything was underneath the dressing, it's fine to tape barehanded, but it certainly provides extra protection to you if you go ahead and put your clean gloves on. It's not always the easiest way to tape because the tape likes to stick to your gloves, but it's probably the safest. So I'm just going to go ahead and tape and make an occlusive seal around the dressing. We have a tendency when we're doing this on the mannequins to want to push down and go like this and make a nice seal, but remember this is a patient's abdomen and that's probably their incision is going to be painful, so keep that in mind. This one just a little too long. Just tear that off. I just want to make sure that's occlusive. And then the last thing that I would want to do is go ahead and label. You can just use a small piece of tape, time, date, and initial, and put that in a visible area on the dressing, and keep your pen away from the mannequin. Like I didn't just do. Of course, you're going to document. This is just a nice way for the next nurse to easily see when you last changed the dressing. I would wash my hands again, cover up the patient, put the bed back down in low position, and clean up my trash. The last thing that you want to do is document what you just found as you did the dressing change. The first thing that you want to think about is the location, describing that so that you paint a picture for the next nurse that has to follow you, and she knows exactly where the wound is. So the location of this particular incision was below the umbilicus. It was midline, middle of the abdomen. It was a vertical incision. The particular incision had 6 sutures. You would document sutures, staples, steri strips. That would be important as well. The penrose drain was directly beside the incision as well. The other thing to think about is the skin condition around the incision and around the drain. Was there excessive redness? Was there excessive swelling? You certainly would expect some. And did you notice any skin breakdown? That's important to document. The other thing is the amount of drainage. We talked about when we took the old dressing off, looking at those dressings and documenting that. You're looking at the amount of drainage, the color of the drainage, the consistency. If there was a foul odor, that would be important as well, because that would indicate a sign of infection. Some words to describe the type of drainage that you might see besides just the color. Serous is a clear drainage. Serous sanguinis is sort of a lighter red, a pink color. It's a mix of serous fluid and blood, and then sanguinis would be frank blood. So that would be those would be important words to use. As far as the drainage is concerned, scant, moderate, large, saturated are words that you could use to describe the amount of drainage. Another word that you might hear is the word strike through, and that just means that the dressings were actually saturated and the drainage soaked through the other side of the dressing, and that's considered strike through. And probably the last thing that you want to think about is how the patient tolerated the procedure. You know, if it was very uncomfortable for the patient, you may need to consider the next time pre-medicating the patient.